For mental health awareness, no time could be better than now to have the talk on depression with its increasing prevalence. Globally, 5% of adults are said to have major depression, and in the US, 8% of adults are said to be affected each year. Yet, due to stigma very much surrounding mental health illnesses, including that of clinical depression, these data might just be an underestimate of the true prevalence. Clinical depression heavily impacts the livelihood of those it captures, ranking among the top 3 causes of disability in the US. Still, its symptoms can very well be unrecognized as a problem needing intervention. In this video, we will learn more about these symptoms and ways to cope with this health challenge. Hi, I'm Dr. Francisca Osage. Thank you for joining me and Francisca on Health Matters. Now, what is clinical depression? Now, as a clinical diagnosis, it is categorized under mood disorders. It's also called major depression, and it's described as unipolar, in contrast with bipolar disorders. Bipolar having symptoms of mania in addition to depression. And it is the persistent feeling of sadness or depressed mood and loss of interest. However, in making this diagnosis, mental health experts refer to a diagnostic manual, the DSM-5, where required criterion for making a diagnosis are specified. This criterion requires the meeting of at least 5 of 9 specified symptoms, of which must occur for most part of the day, nearly every day, for more than 2 weeks, along with a clear change to day-to-day functioning of the affected person. These specified symptoms are depressed mood, loss of interest or pleasure, appetite or weight disturbance, sleep difficulties, psychomotor agitation or retardation, which is shown as senseless body movements or agitations or slow movements, fatigue or loss of energy, feelings of worthlessness or excess guilt, diminished ability to think or concentrate, recurrent thoughts of death, suicidal ideations without a specific plan, or a suicide attempt. However, the diagnosis is at the discretion of the clinician or mental health specialist who puts into considerations all factors present. It's also important to realize that depression is not just the feelings of sadness that we can try to get over it. The feelings of sadness is a natural response to an unpleasant situation or event, and the main distinction between these concepts involves our coping responses. Now, despite our sadness, we can wake up and engage in various commitments or tasks and responsibilities in a meaningful way and even productive way. Now, this becomes a huge challenge when facing depression. A huge challenge with this condition, like other mental health conditions, is a lack of an objective tool in diagnosing this condition. Unlike other medical related conditions that can be diagnosed based on objective demonstrable tools such as blood work or diagnostic imaging such as x-rays or CT scans. Now note, although there are certain tools capable of demonstrating certain changes that occur in the brain and altering levels of chemicals called neurotransmitters involved in this condition, these are not typically used in clinical settings. Diagnosis is hugely based on information provided to the clinician by the affected person or an informed person presenting with the affected person to the clinic, and other cues that might be evident during the clinical interaction. Another challenge here is the stigma associated with this diagnosis, and in fact most mental health illnesses. It's important to recognize that this condition, like other medically related conditions, involves dysfunction involving the body system, and in this case we're talking about the brain and the nervous or the neuronal system. Diabetes, for instance, is due to the dysfunction in the control of blood glucose. And think about other common conditions such as hypertension or other inflammatory conditions. Now, in these conditions, there is an underlying dysfunction or challenge within the systems that help to keep these conditions under control. And it is no different in conditions affecting mental health. Unlike other medical related conditions, there could be genetic susceptibility, but then appropriate interventions by Identifying and treating these conditions can help the body fix itself or control these systemic challenges. Think about the impact this condition, that is major depression, has on the lives of affected persons. This condition negatively affects a sense of self-worth. It causes deep distress. It affects physical health, family dynamics, work productivity, personal finances. It puts a heavy strain on relationships. And these are just a mention of a few effects. It is an unseen giant that cripples the people involved. There is also the responsibility of family and friends and associates of affected persons to recognize these signs and symptoms and not underestimate expressed feelings and worries of affected persons. Be careful or cautious with the use of words like being lazy to describe these observations, or phrases like get over your feelings. These experiences of affected persons are rarely within their control. Be alert to signs of psychosis that could occur in cases of severe depression, whereby the affected person is having challenges with being connected to reality and is having experiences such as hearing voices, seeing things, having thoughts and ideas that are not real or present. This requires the urgent attention of the clinician. Also, be highly attentive to expressions of suicidal thoughts or ideations. This definitely requires prompt intervention by a clinician. Now, the causes for depression have been linked to certain neurochemicals or neurotransmitters within the brain. And the main neurotransmitters implicated in the causes for depression include serotonin, norepinephrine, and dopamine. However, modern research is bringing light to more neurotransmitters, including what we call receptors, that are implicated in this condition. These implicated neurotransmitters form the basis of the usage of certain formulations used in the treatment of depression, otherwise called antidepressants. And examples of this will include the SSRIs, that is the selective serotonin reuptake inhibitors, as you have in fluoxetine, popularly called Prozac. You have the SNRIs involving norepinephrine. Example will include duloxetine in the brand Cymbalta. You have bupropion, which affects dopamine, and you have this in Wellbutrin. The triggers to major depression can be very complex. We typically relate with those triggers that are life-altering and causing significant stress. Examples would be a significant loss or death of a loved one, divorce or breakups, financial insecurity. However, there could be underlying risks to the development of depression, and this could be a genetic predisposition, a history of abuse, be it emotional, physical, sexual, a history of addiction. It could be unstable family dynamics. There are other nuances, such as cultural influences, in which high values are placed on certain expectations or attributes, which subconsciously affects persons faced with challenges in attaining these highly placed cultural values. There could be the influence of a change of environment, such as a change in location or the season, such as during winter. But first, there will be the need to rule out or exclude other medical related conditions. And this must be addressed first. This could be hormonal problems, such as in thyroid dysfunction, in hypothyroidism. There could be the chronic use, that is, of steroids, um, the use of substance of abuse. Management is based heavily on these information and other observed cues during clinical interaction, and this is why we need to be highly cognizant of these symptoms linked with depression, the life changes and other associated events and risks that could trigger a major depression, in order that we can communicate these to the clinicians And also, it emphasizes the need to be extremely open and vulnerable. Management most times will involve the use of therapy that could address specific issues, the use of medications, that is, the antidepressants, or the use of therapy and medications. There might be the need to retain an individual via admission, especially if there is a risk of harm to self or others, until the person is deemed safe and in stable condition. With a wide selection of antidepressants, it is not a one size fits all. We can prescribe our preference. However, there are certain information that will help determine what is most suitable. There are lots of considerations the clinician considers when deciding on a medication. This will include what has worked best in the past, if there's a prior history of depression controlled with a certain medication or medications. There's the need to consider the presence of anxiety, history of addiction, history of alcohol abuse, history of seizures. Also, when starting on any medication, there shouldn't be the hesitation to express concerns of observed side effects, such as weight gains, loss of sexual appetite, sleep disturbance, heightened anxiety. Some side effects might be transient. However, if they tend to persist and are very bothersome, there can be better alternatives. This will help to guide the clinician. Also, and most importantly, when faced with feelings of harming oneself, or if you know someone who harbors this feeling, promptly seeking help is extremely crucial. With this awareness, I hope we are more equipped to deal with this condition and can join hands together and encourage one another when faced with a diagnosed major depression. Again, I hope you found this informative and educative. And if you've had, please subscribe. And I'll see you in the next one.